we can go ahead and start. The first few slides are pretty familiar content, so we should feel really good about this stuff, hopefully. While we're waiting for Monica's return, we got about 20 folks on here, so I think we're good to go. So like I said, you should be coming to session 4 of our North Dakota Medicaid Academy. We will be talking about the exciting topic of policies and procedures. So hang on to hang on to your seats, guys. Hopefully this won't be too bumpy of a ride here. But knowing, that everyone's at different spaces right now in their day, I am kind of curious to hear how you guys are doing. So how can you tell me that, right? So we can do it the old-fashioned way. You can just say it. You can write it in the chat. What you also can do is you can use the annotate feature of Zoom. If you kind of float your mouse up to the top of your screen, you might see something that says annotate. It has a little pencil mark. We've used this before to talk about our location, and they have pencils. You can draw. You can put a little sticker there. Tell me what today is like for you. What time is it? I'm a little tired. I put star over there. Is this early where I'm at? Ella's happy, all right. And if that's a little too techy, feel free to just tell me in the chat how you're doing today. Or even say it. That's allowed. You guys are allowed to talk. I promise. Heidi's happy too. Just doing well. Awesome. Doreen too.
Thanks for the chance to practice the annotate tools. Quite.
It's always a nice chance. All right.
Back to school. Yeah, I bet a lot of people are in back to school routines or building routines.
Routines and space, right? Less disruption, hopefully, now as a result of some of you guys are teleworking or having some hybrid opportunities. All right.
Got a bunch of family members or teachers. They're starting tomorrow. They're both starting tomorrow too.
Oh, that's true. So who should be in today's session? So like I said, we're talking about policies and procedures. So the folks that have maybe hopefully a lot of say, right? The executive lead, someone who's steering the ship here, should definitely be on today's session. And as we know, for some organizations, especially if we're new in our infancy or just small, right? We're wearing a lot of hats. So this might be the same person here today. But if not, then if you have a partner who's serving the people who are providing the direct services in your agency, or maybe even doing it themselves as a program lead, those people should be on here too. They have a lot to say about how things actually go, how services are delivered in your organization, and also need to be aware of what may need to change now that we're implementing Medicaid, or if we're expanding our Medicaid services. So just making sure, go tell them, send them the link if they're not here, because they need to be here. So who are we? Hopefully you're used to us by now. My name is Ambrosia Crump. I'm a senior program manager here at CSH. I'm providing support with our project and standing up Medicaid for inside of your agencies, providing TA and helping to co-facilitate this training. Background for me is in housing space and in behavioral health services. So a little bit of different stuff in my past, as well as working for a local COC for some time in my community. So happy to be part of your group if you haven't met me yet. Marcella, who are you?
Who am I? I'm the privilege of leading CSH's national work on health and housing integration. I'm a psychologist by training. Like Ambrosia, I've done a lot of work in the homelessness space, done a lot of work in managed care, done a lot of work in Medicaid financing. I found so many clinicians who know what needed to be done and couldn't figure out how to get it paid for. So that's where I put my brain to for the last decade or more of my career. So I'm happy to work with the state of North Dakota for the last couple of years, and also to see all the new opportunities you have in order to deliver quality behavioral health services to folks who really need the assistance. So excited for today's conversation. Thanks, Ambrosia. Back to you.
Great. So what are we going to be covering? Like we mentioned today, sessions on policies and procedures. The tool that will complement that will be a sample policies and procedures. You may see some housing language reference in there because one of the services under 1915I is related to housing support, but we do acknowledge the fact that your organizations may not necessarily be involved in that. So you may have to modify some of the policies outlined or some of the language outlined in that sample tool that we give you to reflect the services that you are going to be offering. So keep that in mind that yes, we have a resource. It's really just an example. Feel free to use it or not use it, right? You might be further along in this stage where you might have some policies and procedures, and we're just going to talk about maybe some things we want to make sure are part of those policies and procedures, and also maybe some changes that we need to implement, knowing what we're going to be starting to do. So with that in mind, again, just remember, DHS, they're the ones that are going to tell us the what. And Monica's actually going to talk a little bit after this about specifically what the requirements are policy-wise for folks implementing the 1915I. Our role is not so much influencing what will be the case, but maybe just how to do that, right? So our role at CSH is not to define your duties, not to define policy. It's really to talk about how you're going to make this happen in your organization to optimize your funding opportunities here to start billing Medicaid or expanding your Medicaid service delivery. And so each session, hopefully you've been getting this, you've been picking up this from us, but we're giving you hopefully helpful tips and tools, right? We want you guys to be active in our weekly Friday calls where you can just, it's an open forum where all of you guys can come. There's no stupid or wrong question. You can share your experiences. Maybe you've started some of this process. Maybe you're having some hiccups. Maybe you're further along and you have advice to share to other organizations who are at a different stage. We really want you to utilize that opportunity every Friday to talk through what we're going through together. And then also there'll be opportunities for coaching for agencies who just need a little more TLC and a little more one-to-one. And so that's kind of our role here at CSH, but DHS is definitely the folks in charge when it comes to the what. So we wanted to provide some links on the state plan amendment, the resources on how to implement the 1959. Those are direct from DHS. I want to give you guys that reference, and you should have this access to all of this when you get copies of our slides and materials. So what are we going to talk about today? So we need to understand what are the elements of effective compliance programs. So what does it mean to be compliant and how to maintain that, right? What are the elements that need to be there? For some of us who are newer to billing Medicaid, this is a whole new world for us. Now we have a whole new term, and Martel's going to go into this further in the presentation. It's called HIPAA. And so we need to talk about, what are some of the privacy policies that we'll have to start implementing, some of the considerations that we'll need to make now that maybe weren't necessarily part of our world before and part of our practices as an agency or organization. And we'll also be talking about some of the important policies that are specific to Medicaid as well, becoming familiar with that. And also, we're going to be chatting. So I told you, I don't want to just talk at you. There'll be opportunities for hopefully you to say something back to us and to each other. We'll have 2 breakout sessions. We want to focus on what we need to work on as organizations to implement what is suggested in the session, right? So we'll have opportunities to do that today. So I am going to turn this over to Monica. She has a handout. If it hasn't been shared with you, as organizations, we have a copy of that. We'll make sure you get that. But I know there's some specific considerations for the 1959 here in North Dakota that Monica wants to make sure that we're covering. So,
yes, thank you. So this is kind of a backwards way to do this, but I wanted to share a document that actually serves another purpose. So their CMS requires that we do an annual review of our providers, where we ensure that the group providers have their policy procedure in place and all the qualifications they need to be group providers. So I wanted to actually, can I share screen, Ambrosia? I'm not quite sure how to do that on here. I don't know if you need to give me permission.
Ambrosia, you're on mute if you're talking.
This is kind of just a snapshot of the top of this form, but I kind of wanted to let y'all know what we're going to provide and
what I can do, because I have it, if I may not have full control, I can just show it for you.
Yeah, let's do that.
Okay.
Let's do that. That's perfect.
So while we're talking through it, we'll get that up.
Yeah. So everybody will become familiar with this form because, like I said, it's an annual reporting process that will be due. I think they're going to be due like April, end of April each year. And there's one form that the agency does for their group, for the agency. And then there's a separate form that we need to have the individual providers review as well. We're not going to cover that today because there aren't specifics to policy and procedure on that form.
See that? I can try to make it a
Here
little
it
bigger.
comes. Perfect. Okay, so you will see that, like for requirement number 1, agency provider documentation of internal policy that requires individual practitioners of services meet their qualifications initially and ongoing. So throughout this document, and this several pages long, there are statements such as that will help you guide what you need to do to address all of the required policies for 1959. So, just kind of pulling out some examples for requirement number 4 there. Agency provided documentation of internal policy that agency conducts training per state policy. Should state what training is required for individual practitioners and how the training will be provided. And while we can't offer any specific guidance on what your policies say, I want to make sure that everybody's got the information on what we're going to be looking for from you as required policies. And like Marcella and Ambrosia stated, there's also some best practices definitely that we're going to want to see, you implement if at all possible as well. But yeah, throughout this, most of these requirements all have like related policy items to them. So we'll make sure we get this shared with you as you're going forward and ensuring that you do have, all of your policies covered. So then when it comes review time, you should just be able to pull out that section and just send it in and you're good to go, rather than having to scramble to write specific policies.
Monica, is this form yet up on the website? I'm on your 1915I forms page. I'm just wanting to drop something in the chat.
No,
Yeah.
I couldn't find it, but
Getting it up.
Yeah, and this is subject to change. It might get tweaked a tiny bit, as we go each year, we're improving things. But for the most part, what we're requiring for policies is not going to change. So while this might not be the most current form 2 years from now, what's referenced here as far as your required policies is still going to be accurate on there.
Give everybody in the chat the forms, your forms page.
Yep.
Yeah.
You found it on the forms page?
I did not find it on the forms page, but my guess is when you get it up there, that is where you will put it.
Yeah, definitely. And Melissa in our medical services division, she sends out the reminders to the providers. Okay, this is coming up. Here's your forms that you're going to use. So you'll get, you're not going to be all of a sudden, oh no, this is due in 3 days. That you're going to have some warning, and we'll send out the forms. But just know that that's coming each year. So.
I think that's great that they have that checklist in advance so they can make sure that they're creating a policy and procedure that is in alignment with those requirements, right? So it's good to know what folks are looking for. And I have it too, so we can include it along with a copy of the PowerPoint and a follow-up email. And in the meantime, until it's loaded and ready to see online and during, right?
Yeah. So that's all I wanted to say about that. So throw it back to you guys.
No. So it's important to know that we need to be compliant, right? And it's so important because I'm sure it's tied to our continued capacity to deliver the services under the 1959. That's why Monica talked about the checklist and what we may need to be keeping in mind when we develop and we share those policies and procedures and maintain them and modify them. So we want to be compliant. That's very important. But we also need to understand that there's a difference between compliance and quality. Someone can be completely compliant, meet all those check boxes on Monica's list, but that doesn't necessarily equate to delivering quality or even on this picture like a 5-star service, right? And so it's just important to keep in mind that those are two different concepts, that we can be compliant, but we also want to think about quality and what it means to deliver quality services to the consumers, the clients, community members that we're serving under this umbrella of services in the 1959. There's two different things. So what are some just basic 7 elements of an effective compliance program? So there's one of those things that if everyone's in charge, nobody's in charge, right? And so we got to pick a person. So if you're the person with many hats, this might be another hat that you're going to be wearing, which is you're now the compliance officer. You're going to be overseeing this process, evaluating, modifying, turning in that stuff maybe to Monica or that team there at North Dakota. So we got to pick a person. So we need a compliance officer. We need to have some internal monitoring and audits, right? So how do we know that we are maintaining that compliance? What we put on paper and pen, is that in practice? And so the way we find that out is we conduct regular monitoring. We conduct regular auditing. Having something written. So it looks like that's going to be required for us. But if we haven't done that already, maybe we're thinking we're great practitioners. We're ethical people. We know how to do this the right way. We're subject matter experts in this space of the service we pick to deliver, but there needs to be written standards, written policies so that we can make sure that this is consistent across the board and people know what to expect from us. And then how do the people that you hire know what the expectations are, right? So there has to be a plan to train the folks you're going to be onboarding under this new service. What is the education program that you're going to be utilizing or resources you're going to be tapping to make sure that your staff are up to speed on what's expected and what is our practice model here and why? Open lines of communication. How is that information disseminated? How are changes shared when there's a policy change? Like Monica said, there may be edits to this form, and then that means there might be edits to your policy or your compliance documents. So that means people need to know what the changes are. And then say you do an audit or you do some monitoring and you notice there's a problem. Maybe we're having some equity issues when it comes to how services are delivered or accessed as opposed to maybe the population in our community. Or maybe people aren't submitting documentation timely, right? All the problems that we might be looking at, what are you going to do about that? What's our response to a problem? It's definitely not to hide it. So we got to figure that out. And then, unfortunately, maybe there has to be a conversation where there's disciplinary action taken as a result. So what are those standards? And is that equitable? Is that fair across the board and be able to be replicated accordingly? So it has to be written, right? So what is a policy? So we just have a quote here that says, a policy is a guiding principle used to set direction in an organization. So think of policy as like the rules, the official rules for your organization, what you believe in and how that's replicated in policy as a result. So if you have a mission, if you have a vision, this is why you started your organizations, right? This is why you got into this space of service. Does your policy reflect those guiding principles, those beliefs, those things that you want to make sure happen? That could be, we want to make sure that we're serving folks maybe in a concierge level, right? So our whole thing is we want to be the ones on the ground talking to you directly and not farming you out to other people. This is a guiding principle for us, is to handhold these very vulnerable clients through the system. So our policy needs to reflect that. Or do we have a 24/7 policy? What do we do when after hours emergent care arises? And we said that our principle is that we're always there for our clients. So how does the policy reflect that? That's important to understand. What are the rules for your organization? So we have policy, and then now we have procedure. So we just have a quote here that says, procedure is a series of steps. This is how you do the policy. So I have a belief about how things should happen in my agency, but how does that get operationalized? How do I walk that out every day? And the folks that didn't found the organization with you may not be privy to what that looks like, right? They're new, or maybe new to the field altogether. You might be onboarding new staff and who are new to all of this. They need procedure to follow. So the procedures are all about your process on how to do or implement the policy. So just some examples of some policies that you may want to implement if you don't have these things already. Some of this is HR specific. There are also operational, and then what we do for clients and who are our clients. So we may need to have a non-discrimination policy. What are our clients' rights and responsibilities? Usually this is something that's reviewed and signed by a client when they start your services with you so that they understand how things should go. What about the staff internally, their rights and responsibilities? How do they handle a grievance if there's a problem? And volunteers too, right? Hopefully you guys have some volunteers to help fill some gaps. And then also just the basic HR recruitment, hiring, any other relevant HR policy. What are we going to do about privacy, and data collection. Now we're getting into the Medicaid space, right? So we're getting into a whole new world, and there's requirements that align with that. And so how are we going to protect the data that we're collecting, the records that we keep for our clients now that we're in this new space? So we need a policy for that. And I talked about earlier, what is our organizational mission? What's our vision? What are the value statements that we hold dear? Someone who's never been here before, who's orienting to your organization, should be able to pick this up and understand who you are and what you're about. And the way they're going to find that out is if we document that, we memorialize that in our policy. And then what are the productivity requirements? We talked about last week, services and billing and total cost of care. And so some of that analysis for some of you who are newer to this is figuring out what it's going to take productivity-wise to make this happen and to sustain our organization. So staff need to know that. Like, what are the requirements for me to maintain here? What are the billing practices that we need to follow to make sure we get reimbursement from Medicaid? That needs to be outlined in policy. We can't do it differently at different sites or by different case managers or providers. Everyone needs to be on the same page on expectations and process. The policy needs to reflect that. So some other accompanying procedures, right? So we have the policy or framework. Now this is how we walk it through. So how does a person follow a policy? They have to have a procedure. And so they need to know how to collect and store client data. We're going to talk more about what that looks like with HIPAA. How does someone request copies of their records, right? So now you're a medical provider, if this is new to you, and people are going to need copies of their records for a variety of reasons. So how are you going to fulfill that? How are you going to store records? How long do you need to store them? There's all these things we need to keep in mind if this is new for us. What do you do about health emergencies, communicable diseases, right? We're on the tail end, hopefully, with this pandemic, maybe transition to endemic. And we need to know what's going to have to adjust now according to CDC guidelines or other things that are coming to play in our world. We know this very well, very intimately. We're living that out every day. But now we have to keep this at the forefront of our mind. What's the procedure that we have to follow? What are we telling the clients to do? What are our staff having to do when they go on a home visit or providing community-based services? How do we do things to make sure that we're being the best we can be? And so we have a session 6, we'll talk about quality improvement. But what are some of those activities to make that happen for us? What is our internal auditing process to make sure, again, that we're not just compliant with basic requirements, but that we're providing a quality service? So what's the procedure to audit that and monitor that? You may want to consider, waste, abuse, and fraud prevention. Some people are worried about maybe taking too much paper or pens, but this can also be making sure that we're billing Medicaid accurately and that we can have records to back that up, because it's a whole new can of worms when you have to come back and explain why something got double billed and we have to give money back. So we want to make sure we're doing it right up front, right, as organizations. So we want to have some preventative stop gates, checks and balances in place to avoid any issues. Again, that might follow with corrective action, disciplinary processes we need to implement, staff supervision. We're getting in some of us into new territory, new services that we're offering that we may have not offered before, and the staff may or may not be experienced in that. So what is the plan for supervision for these people? Can you provide that? Do you need to outsource that? What is the process and how frequent, and what does it look like? And I mentioned too, we want to make sure that we're delivering services in an equitable way, that we're inclusive in our policy and procedure for the clients that come to us, for the staff that work for us. We want to make sure that access is equitable and is reflective of the community that we're serving. And so how do we know that? What is the policy there? We believe we want to be equitable and we want to be fair. That's our belief, policy-wise. But what's the process that we follow to walk that out every day and to monitor and check for that to happen? And then, like we talked about earlier, the staff have to know what the expectations are. They need to be trained, and there needs to be a documentation of training. Monica talked about people having certain credentials and backgrounds, and they'll be checking for that. So you have to document that so you're ready to provide that information when it's requested by the state, by Medicaid, all the sources, right? So we have to be able to have a plan for this. So client-specific stuff. We talked about earlier the rights and client grievance and rights, right, at the beginning. That's one of the first things that folks sign. They have to consent for your service. They have to be aware of how to access records and have to be able to release information to you and from you. And we have to know how to do that in an appropriate way under the umbrella of HIPAA. What are the documentation requirements for your organization? How are you keeping that stuff? I hope it's not in a big Google Doc in the cloud unsecured, right? Like everyone go in and write your case note. We've seen that, don't do it. What's our system and how are we gonna keep the client documentation safe and secure? And what are the Medicaid billing requirements? So how do we make sure that the note or that the record reflects what's required by Medicaid so that we get our reimbursement? And again, we talked about what if our principal is making sure we're always accessible to the client, and it looks like there's some standards in that form that Monica shared about access. And so, do you have an on-call service? Is there a rotating cell phone? Who's going to be holding that, and what's the process when there's an emergency? And then safety, when things go wrong or if there is danger. You know, sometimes folks in distress situation, when they're accessing services from us, it's pretty high stakes for them, right? There's some big things that are happening in their life. Sometimes we're helping them out. Sometimes we're maybe saying no when they really don't like that answer. And then maybe things don't go well, unexpectedly in a visit. So what do we do to keep staff safe, and how do we mitigate that risk? And then reporting, right? If there is a critical incident, what is the plan for reporting that? Who do we report to? Where do we keep this information if it's ever required? And as providers, I'm sure you're mandated reporters. So if we're seeing stuff like child abuse, adult abuse, elder abuse, what is the information that's going to be stored in the organization? What do the employees know about their expectations around that? Are they aware that they're mandated reporters, and what's the process to follow? Do they know the numbers? Do they know the mechanisms to report as needed? And then you want to know that you're providing good services, right? We talked about quality. So the way you find out is you ask your client. And so are you collecting tenant surveys or other types of surveys for the services that you deliver so that we know that clients are getting what they're expecting to get from you? How do we know we're doing good work? The clients tell us that too, right? So quality reviews. Who's going to conduct these? These are just some questions you want to think of. Who's going to follow up? And who documents the follow-up? So what is an internal organizational process with that? And then if we find out something goes wrong or if there is an issue, how do we prevent that, right? How do we be proactive? Also, we need to consider, unfortunately, things happen to our clients and we need to debrief that. So is there a debrief plan here? Who's included in that? Is it leadership? Are there board members if you're a nonprofit? What are some things that they need to be kept abreast of? And who's going to collect the data, track your metrics? Who tells staff what happens afterward? Maybe there's a policy change, maybe there's a procedure change. So who's going to tell the staff that, right? And then who determines the frequency and scope of those internal audits? So who is the decider? And so what do you do with your findings when you're doing those internal audits? Just some things we need to keep in mind if we're not already doing this stuff, right? Okay, so Martel's going to tell you guys about HIPAA. And very, very important. Some of you guys might know this, but maybe it's still important to keep your eyes open in case there's something we didn't consider anyways. And for those who are new to this, please pay attention to the content we're reviewing here, because this is a whole new world, a whole new life. But it's important.
All right. Thanks, Ambrosia. But I also want to normalize this. I also want to say that this is what all of healthcare entities do. And HIPAA just seems to be a word people throw out. If you want to scare people, just tell them the word HIPAA and you'll be able to scare them. Look past it. We're going to help you unpack it. We're going to help you break it down. We're going to help you think, okay, what's important? HIPAA basically breaks down into two major pieces. One piece is what they call security, and that's really tech security. Can somebody hack into your system? Can somebody grab people's information? How? Because HIPAA is really all about how electronic health-related data is transmitted. Then there's questions about privacy. How do you work to protect privacy? I'm not going to go too much on the tech side. That's not what we know. But I will tell you that the privacy side is really all about you making some efforts in order to keep data private, and then you following those efforts. So as Ambrosia said, it's about having policies and procedures, then making sure you follow those policies and procedures. In our template, there'll be a whole section on HIPAA and all kinds of examples of here are some things you can do to show you're really making an effort to keep data private. There's a link to the Federal Health and Human Services summary on HIPAA. There's some training materials in there, more things that you can read. I've literally read the law backwards and forwards and all these materials. Like I said, it's all on the privacy side. It's all about your policies and procedures. That's what we do it in this section, and following those policies and procedures. There's also a lingo you've got to learn in regard to HIPAA, and we're going to help you learn that. The first thing you need to learn is the concept of protected health information. Protected health information is any clinical related information that, if it's associated with a person, like a diagnosis, you've disclosed health information. So everything you do in your policies and procedures is that how are you going to keep protected health information, or what people call PHI, protected, and making sure that not any random person can access it, that anybody who has access to the information needs access. You'll also see in our policies for some procedures template something called PII, which is protected individually identifying information. That's if I have this information, it's not health related, it's like a date of birth, a social security number is the best example of this, but I would know who you were talking about if I have that information. It's important to keep both, and your policy and procedures to mention that you're keeping both PHI and PII secure, and people only have access to it if they are allowed to have that access. You've got a process for that. So next slide, please. Again, we just want to normalize this. We want to give you the information, help you understand that, help you think about how you integrate this. So clients under HIPAA have a lot of rights. Here are many of those rights. You have to say that you're going, your policy and procedures, that you're going to uphold these rights. They can ask to see a copy of their health records. They can say, you didn't get that right, you need to change that. They can get a notice about how you're using their health information and share it. If anybody's gone to the doctor's office today, there's 10 things you have to sign, literally, that says, here's how we use your information. Here's how we keep it secure. Is that okay with you? By signing, you're giving that consent. They have to ask if they're sharing that information in any way. They have to tell you how it's being stored. They have to tell you if they're using for any marketing purposes, etc. Clients have a right to get a report on while their health information was shared. They can ask for that. They have to know anytime their health information was breached. So if your system, hopefully this never happens to you, but if you've lived through a breach, you have to have a process that says, God forbid our health information gets out, we have a security breach. But if we have a security breach, this is what we're going to do. Here's how we're going to identify to everybody what we how we're going to handle that breach, how we're going to let people know, how we're going to clean up after that breach. Clients also have a right to file a complaint with their provider, with the insurer, with the government, if they believe their rights have been violated there. So something providers might not be used to. I can't tell you when I worked for an MCO, how many times we followed up with providers. I could, no, we did all these things, et cetera. I'm like, I know you did. There was a complaint. We have to do an investigation. So help people normalize and understand that process. And a simple complaint is enough to trigger an investigation here. And you're going to have to, part of what you've signed on the provider agreement is that you agree to cooperate in any of these investigations. Again, investigation, big scary word, just means we're going to ask you some questions. Somebody said this happened. We're trying to find out what happened. So next slide, please. HIPAA is there to protect our clients' rights and all of us, as we're all health patients. So the basics of HIPAA, as I said, the fundamentals here is your agency has policies and procedures. That's why we cover HIPAA in this section. And then you follow those policies and procedures. So don't write things you can't do. Show that you are making a good faith effort to keep protected health information and personally identifiable information, PHI and PII, secure and not disclosing to people who don't have a right for disclosure. So that's sort of the big idea here. Write down your policies and procedures in this way. I will say that the security piece of HIPAA is something that it's important that when you're looking at your billing systems or you're looking at electronic health records you may be doing, it's also important that those systems are HIPAA compliant, they are secure. You're going to ask me what secure means in this case, and I'm going to defer you to somebody who's way more savvy around tech than I am. But this is something, the first thing when you're talking to somebody who's trying to sell you an electronic health record is it HIPAA compliant? And how do we know that it's HIPAA compliant? You're going to really want to be pushed. You're going to want certifications on that. Next slide, please. So here's a couple of the key terms. Once you start getting into new areas, you got to know the lingo. Confidentiality. How do we make sure that people don't have, people aren't shouting my diagnosis and my meds and all these things from the rooftops? How do we know that only the people in a doctor's practice, in your agency, et cetera, have access to the information they need? I talked about PHI already. Electronic PHI or ePHI is what are we transmitting? For you, we'll get this when we get to billing, but you are going to have to transmit a number of different health-related information when you submit your claims. You're going to have to transmit diagnosis, in particular when you transmit your claims. So when you're sending your information in to North Dakota Medicaid, if they're paying you for the traditional Medicaid population, if you're sending your claims into Blue Cross Blue Shield, the expansion population, you're doing that electronically. That means you have to be covered by HIPAA. That's EPHI. Covered entity. Covered entity is any agency that is required to be HIPAA compliant. You, as now billing Medicaid, will be considered a covered entity. So when you talk to Blue Cross Blue Shield, when you talk to any other providers that you might be developing MOUs, they're going to say, are you a covered entity? And you say, yes, we are HIPAA compliant. Here's what we're doing in order to maintain our HIPAA compliance. HIPAA also thinks in terms of, as I said, because it was really started, the laws from 1996, it was about when you're first starting to get to electronic data transmission. It talks about what information do you hold in your offices, what is held data, all your progress notes, your person-centered plan, your diagnostics, your clinical records, et cetera. And then what is transmissible data? What's data that's going out from an electronic point of view? From a claims perspective, you need to be transmitting diagnoses. That is required on your claims for them to be payable. So you're contributing that. So you're electronically transmitting that. The other question we have is also one around what other data may you be transmitting electronically for collaboration with inpatient facilities, collaboration with ERs, collaboration with doctors' offices. You're the home and community-based services, behavioral health services mix. People may have a lot of other doctors, a lot of other resources. Again, all really important here. So just a couple of the terms to help you feel comfortable in this space. Next slide, please. So HIPAA requires that you, quote, and this is all straight from the law, maintain reasonable and appropriate administrative, technical, and physical safeguards for protecting PHI and EPHI. You're going to ask, how is that defined? The law doesn't really define it. It doesn't really break that down. We'll give you a lot of examples you can use that you can put in your policy and procedures, or it's already in the template to say, look, you're making an effort. You know confidentiality is important. You know not sharing people's PHI is not good, and you're doing everything you can in order to protect their rights of confidentiality. You want to ensure that the confidentiality of the information, the integrity and the availability of PHI that they create, that your agency creates, receives, maintains, and transmits it. You want to assure that. You want to identify and protect against reasonable threats to the security and integrity of the information. This is things like when you transmit PHI in an email, you have to put confidential in the subject line of your email, and then that encrypts your email so that random hackers can't get in and grab that information. These are the reasonable efforts in order to make sure you're maintaining confidentiality and data security. You have to protect against reasonably anticipated impermissible uses and disclosures. You're going to be required to do an annual training for all your staff on HIPAA, just to keep it in their minds, train them on your policies and procedures, make sure they're following those policies, procedures, et cetera. That's one way to protect, and just remind everybody once a year against reasonably anticipated. You're going to work to ensure compliance in your workforce. So this is also part of your policies, procedures. What system do you have in place to make sure everybody attends that annual training? Or maybe you use something online and everybody has to sign on and use that, et cetera. So how do you ensure compliance in your workforce? How do you ensure they put confidential in those emails? They can't just sign into a computer that has protected PHI on it. You have to sign in using the passwords, et cetera. Password protected spreadsheets. All of these things are showing that your agency is making good faith effort to maintain those reasonable and appropriate safeguards. So next slide, please. So security regulations. This is the technical piece here, and we'll refer you to other folks who maybe have more detail on this. Client records are legal documents. You have to treat them that way. An electronic health record or an electronic medical record, all of those are legal documents. You've signed in your provider agreement that DHS or Blue Cross Blue Shield can have access to them for the people that they're covering, their healthcare coverage at any time. Remember that. Clients' records include electronic paper. They include any scanned records, anything that might be considered in an old school chart, an old school file or folder in your electronic systems. You have to take reasonable steps to keep records secure. And you have to think about offsite considerations, especially for you all. Here's what you do in the office to keep information secure, and then here's what you do when your direct services staff are out in the community to keep information secure. You have to have two separate processes and procedures because there's a lot of things in that community-wide that don't make sense in an office. So for example, locked record cabinets, locked computer systems. That makes sense in an office. How do I lock records when I'm in the community, when I'm in a car driving from client A to client B? So you've got to think about how do you keep everything secure in that way. Locked bags, thank you, Ambrosia. Example. So yes, so think about offsite considerations as well as your office considerations as you think through what it is you can do that is reasonable to keep client records secure. Next slide, please. So here's just a list of some reasonable steps. Remember, we took this from the law verbiage that said that you could take. You could have electronic logouts, automatic logouts of electronic records and computers. If I don't go into my computer for 5 minutes, my computer locks down, and I have to have a password in order to get back in there. Something simple shows you're making an effort around confidentiality for your computers or any kind of electronic record system when it's idle. Password protected spreadsheets, password protected email, etc. Get a unique username and passwords for each of your staff members. You're going to want that from administrative wise, but that's also something that you want to note in your policies procedures, and that you can use to say this is something else we're doing in order to maintain confidentiality. Screen covers for phones, laptops, if they're used in a public space. How do I make sure that if I have to use my phone to do some record keeping out at a community, do I have something in the kind of cover so people can't see what it is I'm using, what it is that I'm writing? Noise machines, if I'm in an office, something that keeps everything quiet, so that people can't walk by your office and hear, oh, what's going on in that session, etc. Again, good faith effort here. Monitor the copy machines and the fax machines for PHI. Somebody passes by 2 or 3 times a day. People are trained. You don't leave copy machines, fax machines for PHI. You don't leave any paperwork on copy or fax machines. You have a shredder so that anything that does include PHI, when it's not needed anymore, it's not going to the chart, you shred it, you don't just throw it out. That's a basic. And locking your doors and your cabinets where you have any of these records, any of these computers. Again, these are all things that you can put in your policies and procedures and say, see, look, we're making an effort in order to make sure that our protected health information stays protected. Next slide, please. So what helps keep PHI safe and scattered site when you're out in the community, when you're not in an office? Again, locked doors, locked cabinets, great for an office. How do I do a locked cabinet when I'm in a community? One, you want clear policy procedures regarding how you're sending electronic records or data to a central information system. If I'm in a community, if I'm putting something on my phone and a tablet, how does that information get transmitted back to the agency? Electronic billing system, electronic medical record system. Is it in the cloud? Is the cloud secure? Is it back on a server back in our office? You've got to think through these things and say what it is that you're going to put choice you're going to make as an agency. Remember, when we talked about billing, there were all these, when we talked about budgeting, there were all these startup costs. HIPAA really comes in when you start thinking about startup costs. Establish schedules for submitting data to central records, ensure access to central records for staff who travel. How do you do this from a electronic point of view for staff that spend a lot of their time in the community? How do you make sure that electronic data transmission is secure? Locked offices storage space and frequently visited sites for paper records, et cetera, if you still have them. Secure the laptops, do passwords, do fingerprint readers, things to make sure that if somebody finds my laptop, they can't get access to the protected health information. And finally, that annual training staff on how you've decided in your policies and procedures to maintain confidentiality in the community as well. Think about it from an office perspective, have policies and procedures about what you're doing there, and then think about it from a community's perspective, what you have there as well. So these are just ways to think about community-based protected health. Keeping information safe in community-based protected health information. Also notice when you go in a hospital, they may have little like signs or things. I've done, when I was running programs, I would take a screenshot of a particular, every hospital I went into often and now seems to have like one of those little, like a folder or something. Like a paper on the wall that says, hey, remember, don't talk about clients while you're in this public space here, etc. All those things are just reasonable steps that you can do to say, we're concerned about PHI and keeping PHI safe, and we're to making every effort to do so. So next slide, please. So where might you need to use some extra caution? What do you have to think about? Posted reminders, that's what I talked about on the hospital offices, et cetera. See what other agencies are doing. Talk to other people you know who work in the healthcare sector and say, how do you keep PHI safe? Remind people, and this is part of the training, you can't talk about people in a client talk about clients in a public area. So if strangers, people who aren't part of the treatment team could hear the conversation, we can't have that conversation out in public. Photocopying ID cards, faxing prescriptions. Again, make sure you're shredding these things when you're done using them. You are not just leaving that on the fax of the copy machine. I will say the most common breach of protected health information breach is somebody left something in the copy machine. It's gone now. We don't know where it went. That counts as a breach, and you're going to have to follow your policies and procedures for a breach. Handling any kind of discharge papers, whether they're generated by your agency or whether you've got them from another agency that's also serving the individual, from a hospital, for example. It includes the client's name, their address, their date of birth. That's all personally identifiable information. It includes their diagnosis. That means it's protected health information. You're saving in your locked cabinets and stock system. You're shredding. And place where any is nearby. For all staff who have access to PHI, this should also say for all staff who supervise people who have PHI. I may be a supervisor and may not go into the records on a regular basis, or I may be the supervisor, but I have access to it. If I have access to it, then I have to be part of that training. Review your data systems, work with your vendors to make sure your data systems are HIPAA compliant and secure. Perform a risk analysis of your current policies and procedures. Here's what we have in place. What could happen? How would we handle what could happen? That documentation of the risk analysis that you've done, and if it caused you to do any new policies around security of data systems and records, et cetera, that's something the systems are looking for. Again, you're proving to the auditors, you're proving to DHS, you're proving to your clients that you're doing everything you can to keep the information secure. Most agencies have a HIPAA compliance officer. As Ambrosia said, in a big hospital system, this is one person's full-time job. In your 2 or 3 person agency, this is another hat that you're wearing, but it's something that you're thinking about on a regular basis. Hey, it's November. Every November, we review all our security policies. Just, make sure, I just picked November out of a hat, make sure things that come around. So that you've got somebody who's thinking about it and really thinking about it with that lens at least once a year. Revise your policies and procedures. If you have a breach, it's really important. The state's going to ask you for a corrective action plan. Hey, you had a breach. What was that breach? What can you do to try to make sure that breach doesn't happen again? That's the plans that they're going to be looking for. Analyze your risk. Here's what you're doing to mitigate that risk. Designate staff positions. You need to know, not Marcella has access, Ambrosia doesn't, but what are the staff roles that we are each using? So it's irrespective of who the person is. All of our direct services staff are going to have access to PHI. They have to be part of this training. All of their line supervisors, all of the program managers, all of the whoever it is you have, they're going to have access to this information. They have to both be trained on it. They have to be given a copy of the policies. They have to sign something that says, hey, I was given a copy of the policies. Hey, I attended. So that if I breach, the agency can say, look, we did what we could. We trained them. We gave them the policies, et cetera. All of this has to be documented. This is the kind of thing that if there's ever an audit that people are, or if there's ever a breach and follow up from the audit, they're going to look for that. The auditors are going to look for that information. Yep. Job functions. Front desk staff, somebody shouldn't be reading clinical notes. They shouldn't have access to that information. So they don't need the training, but it needs to be clear that they are not given access to the information. We've also seen, I can't tell you how many times in big organizations where I remember I used to work for a managed care plan. Every once in a while, we found out that somebody went into a data system and found their mom, found their old boyfriend, whatever. That's a breach. You got to train people on that. We had people who actually lost jobs because of that kind of a breach, et cetera. That was part of our corrective action plan. That is a definite no-no. We live in small communities. It's really important to keep this information very, very secure. So next slide, please. Again, these are all just suggestions. If you're new to Medicaid, think about a couple of things. Again, more training from the feds on HIPAA, the False Claims Act. This is a federal Department of Justice on false claims. This is information you need to just review and make sure that everything you're submitting is not a false claim. We'll talk about this in the billing session. Medicaid is very concerned about what they call fraud, waste, and abuse, and you're going to need policies, procedures to make sure that you are not committing anything that would fall under fraud, waste, and abuse. You are not getting any kickbacks. There's HHS on the anti-kickback statute here. Hi, I'm going to refer everybody to your program over here, and then you're going to give me $50 for everybody I refer. Not allowed. That's something that ends you up in federal court. Bad idea. What are you doing to make sure that your agency is not doing that? And then the Office of the Inspector General. This is the recommendation, most recent recommendations. Office of the Inspector General reviews HIPAA like once every 3-5 years, et cetera. So for example, when we first did HIPAA in the 90s and up to probably 2010, 2016, there wasn't anything about Facebook. There wasn't anything about social media, et cetera. Now you have to have policies and procedures that says, we're not going to look up people. We're not going to look up people on Facebook. We're not going to look up our staff on Facebook. We're not going to look up the people we serve on Facebook. You can't post anything on social media about the people you serve. Again, would be a significant HIPAA breach. These are the kind of things that you want to make sure in your policies, procedures, that you train people on, that it's unallowed, unallowable, etc., and that you make sure is followed as well. Agencies are starting to have somebody who every once in a while looks at people's HIPAA, looks at people's social media and just make sure that they're not posting anything that's information that they gain from through protected health information and through their jobs. Really, really important. So this is how keeping confidential, this is why you need an annual review of all of your HIPAA related policies, because what could constitute a breach evolves over time. So next slide, please. So we are going to take a break. I believe we are going to take, Ambrosia, correct me if I'm wrong, we're going to take a 15-minute break. 5 minutes is going to be your break. Go get some water, use the bathroom, do all those things. But then we want you to come back at 1 o'clock.
Yeah,
1 o'clock, right? And then, or do we go straight into breakouts? What do we do here, dear?
Yep, we're going into a breakout. So you guys are going to talk about all of this and maybe some changes that need to happen or adjustments. So be ready
take
with
a break
coffee and convo.
Cool. So 5 minutes, go get a cup of coffee, go get some more water, etc., and then come back and let us know when you're back. And we're going to put you in your breakout rooms at the top of the hour. All right. Thanks, everybody. And thanks, Ambrosia. Great job.
giving us some time to come back. Hopefully you got some coffee, or maybe even in a lot of your guys' case, a quick lunch snack. There's some few bites in.
Hey, Ambrosia, we want to move the slides to the next one, let them folks know.
Yeah.
I hope folks had a big break. You're going to get another breakout room here as well. But 10 minutes now to talk about, look at what your agency has already in regard to policies and procedures and the contents. What needs to be added, what needs to be revised. So yeah, do we want to do 15 minutes for this one, Ambrosia, or was it 10? I can't remember. I'm sorry.
I think we can do 10 because we have another opportunity to chat, and I might want to ask you guys how that combo went for the 5 minutes remaining. So let's do 10 for the breakout.
Cool.
And 5 to tell me what happened.
All right. Hillary, can you send us into our breakout rooms?
Will do.
Thanks. And if your email with us is a Gmail or something that doesn't identify your agency, please let us know, and Hillary can help you get to be with the right person. I know, like Leanne, you and your person, you know, sometimes you guys call each other. That's good too. Whatever works for you. But we want to give you guys time to use the information you've gained here in order to think about what do we have to do next. All right, I'm trying, and Ambrosia and I will try to join a couple breakout rooms. We'll be there shortly. Then Hillary, how do Ambrosia or I find breakout rooms?
Are you able to see any other rooms with a join option or no?
Let's see. Nope, I don't see a join option.
Okay. Do you know where you want to go?
Anywhere you send me, just not the same place as Ambrosia, because they'll have her wisdom.
Okay. Hang on a minute. I gotta find you. Okay.
Hey, Hillary, do we bring everybody back now? What happens next?
Sure, I can do that if we're all set. Yep.
Give them a little heads up, but don't take
Got
them right away.
Okay.
So we just had a quick issue I wanted to mention. So MTC Trains and MTC Medical are the same company. And I think we ended up in separate breakout rooms. And last time I could see how to switch over. And this time I'm on my phone. And so I couldn't. So I just want to mention that.
Got it. Yep. Hillary, when we do the breakout rooms again, can we make sure that those folks are merged together? You said
Okay.
NBC Trains and NBC, what was the other one, Lisa?
It's MTC, so Management and Training Corporation.
Okay.
MTC Trains and MTC Medical are just subsets of the same company.
Got it. Okay. So you all should be in the same breakout room.
Thank you.
Right. Yep. Thanks.
That's good.
Do that classic Zoom thing, talking where folks can't hear me. So I think that everyone's back. So I'm hoping that was a valuable exercise to kind of talk through some of the things that we're learning about and some maybe changes that we need to implement. Did anyone have any big takeaways or big light bulb moments in their breakout room that they may want to share here?
I'd be interested to hear how many folks have to kind of start from scratch versus how many actually kind of have some of these similar policies maybe already established for other programs that they're using. Or
Yeah, I'm trying to figure out where we are in this process. Are some of you just now writing your policies and procedures for the first time, or do you have some, do you feel good about them and where they are? And this is kind of like, oh yeah, this is a reminder of things we know to do. Or do we maybe have some and they need a big overhaul? So where are we at here? And maybe that's a good place to kind of, if you're 1, 2, or 3 in the chat, tell me where you are. 1 is that we're starting from scratch. 2 is we have something and it's awesome and we're not even worried. And 3 is we have something, but it needs some modification. It needs some overhaul. Okay. A lot of 2s, a lot of 3s. Lance, we're at the beginning. Sometimes it can be an advantage. You don't have to retrain staff or relearn a way to do business. So that's not always a bad thing to be at the beginning. You can start with a good foot. A lot of people already have stuff they can work with, though, it looks like. And some folks are comfortable. This is just a reminder, maybe a refresher for them. They're doing great. Let's see. Thank you for sharing. Thanks for talking. So we're talking about open lines of communication here, right? So what does that really mean? So when there is an issue, right, and a staff is concerned, maybe they see a peer doing something outside of our procedure that's in violation of our policy. What is the mechanism that they have to report that to you and feel safe about that? Not worry that there's retaliation. It's different if it's a peer, maybe it's leadership, maybe it's organizationally level. So what's the process there? Have you thought about that? How do people feel safe and tell you the truth, right? What about you sharing information, disseminating it downstream? So there's a policy change, there's a procedural change as a result of an incident, the result of requirement changes, the result of our changes in what services now that we're delivering. So maybe for some of us, we've been doing great business for a long time in a certain way, and now this is a whole new shift in gears. We're going to deliver a new service, requires new skills and requires new policy. This whole HIPAA thing that Marcella talked about, for some of us, we might be familiar. For others, this is a new frontier. How are you going to tell them this? How are you going to train everybody and get them ready?
Ambrosia, can I just add on to that last point that especially with 1959 being such a new program, we're still, I like to say, fixing the plane while we're flying it. And so there's a lot of policy changes, a lot of procedure changes, a lot of things we're realizing aren't going to work the way we initially thought they were. So that how does that information get down to your staff is going to be really important, because we will share, that updated information with the contacts that we have at an agency. And we would expect and hope that you would then make sure that everyone who needs to know that information knows that information. So.
In thinking, depending on your organizational structure, maybe you have a board, maybe you're a nonprofit, you have advisory folk who are or investors, depending on what kind of business you have or program you have. How are they going to know what's happening, right? So is this going to be a regular agenda item on the board meeting agenda? What about how that goes with the compliance program if you're going to be having some direct communication? So I'm asking a lot of wonderings and what ifs, but do you guys have maybe some ideas on how you're going to do this? So some examples could be, do we have like anonymous hotline? Are you going to maybe have newsletters or what, or do you have an internal website where things are posted regularly for staff to read? What are some things that you've thought about or that you guys already have, or you feel like you're really doing good at this that you could share with the group or people might want to consider implementing? How do you share this stuff? Nobody is sharing anything. Oh no.
Do we need to call on people? Because I can see 5 people on my screen, and I bet you Doreen has some processes in place at Dakota Foundation for sharing that information and for making sure, because they've got a really widespread staff.
Yeah, like if there's something going on in the field, or they observe coworker like that first example I mentioned, how can they tell you? Tell me how they tell you. How should they tell you? What's your policy?
Oh, everybody's being fine.
Okay, maybe this is just food for thought. If you don't have an official process for that, now we need to generate one, right? And it can be as sophisticated as a hotline or anonymous survey they can fill out on that you generate, paper one even. It could be an online tool that we develop that people can go to and use to tell us things, because we want to know at the beginning. We don't want to know at the end. We definitely don't want to know after it's too late. You want your staff to feel like they can tell you things, and you want a process to be able to disseminate changes downstream too, right? So we talked about the fact that staff need to know the expectations. What's your training plan? So what are some real life examples of training resources that you guys are using? If you guys are already in that HIPAA world, or you just have an onboarding process for new staff around your policies and procedures and how you do business, what training programs are you guys using? So best practice, hopefully, I always feel like when I go to trainings, I remember the best when when the information is wrapped in a story. When they told me a story about what happened to a client or what happened to an organization, and then that fact of what they've educated me on always sticks with me. So this content may not be the most exciting one that your new staff are going to learn the first day of work, right? And you don't want to hand them just a book and say, here's our P&P, read this. Having actual training developed, giving them some examples of how this went well or didn't go well, that's really the best way to educate folks in a whole new process and way of doing things and why it's important, right? And so this should be part of your onboarding. It should be just a regular job requirement, and even requirements for your board if you have a board. That should be pertinent for them too. And how do you know they learned anything? Did you hand them the policy manual and close the door in their new office? Did they take a test? Are they able to verbalize to you, what's the requirement for storing records here if you're on the go? How long can something stay on the printer before it has to be shredded by somebody? Are you supposed to do that, or are you just assuming someone's going to come by and pick up their printed materials? And how long are things allowed to sit there? That's an example of maybe testing their knowledge of it, right? There's some things to keep in mind, and you want to document to show that they've received that training, especially as we're growing as organizations and have more staff. We may not remember what everyone's done and when they did it. So it's a good way to remember when it has to happen again too. So it's just some suggested trainings within that first month. This is onboarding, right? You get a new staff member, they're new to your whole world, they're orienting to your organization and your practices. You might want to talk about equity and inclusion policy and procedures, your non-discrimination maybe policy if you have that in place, client and staff rights and responsibilities, the general HR policies that you would have. We talked about introducing your organization, your mission, vision, and your value statements. Who are you? They're meeting you for the first time. They're meeting you on paper beyond their job interview, right? So they need to understand and hopefully align with your culture as an organization and your beliefs. How to do the right thing when it comes to the HIPAA world, right? Storing and collecting client data, how to ensure, how to encrypt an email. You might have a software you're using and they need to know what that looks like to enable the encryption on the email. So they need instruction on that. Mandated reporting. We talked about the fact that a lot of us may not realize, but even if we don't have a specific license behind our name, depending on the work we do, we might be mandated reporters. And that we're talking about like seeing child abuse, elder abuse, adult abuse. How do they report that? Do they know they're supposed to? And how are they documenting what happens? What about when things go wrong for the clients we serve, where maybe they're sharing that they have some homicidal, suicidal thoughts, right? So what are the laws in your respective community on duty to warn? How is that tied into any licenses some of your professional staff have and responsibilities around duty to warn? What do you do when clients have thoughts of suicide? How is that managed? And just client safety too, especially if you're doing some stuff that are in group settings with multiple clients. What are some of your policies there? First month, you probably need to know what to do there. And then if things need to be adjusted, what is the corrective action plan? If a staff isn't meeting expectations, they should know what the process looks like. Is there a progressive disciplinary process? Do you have a different altogether evaluation of performance? Maybe it's like a whole 360 thing in your organization. What does it look like to evaluate effectiveness as an employee for your organization? So maybe this is what we need to learn within the first month. So the first 90 days, now we have a little more space, we have a little more breathing room, maybe we shadowed, we've been reading and orienting to our organization. Now we need to learn about how we can fulfill records requests, like we talked about, from clients, from other service providers. How do we share, store information? What is the auditing process? And do I know when we're going to have an audit, and who's going to be doing that? And how does that look? How do we prepare for that? We talked again earlier about health emergencies, communicable diseases, quality improvement activities, our own internal auditing to keep abreast of things and correct things before external auditing. How do I conduct this assessment? Maybe I'm doing care coordination. What does that mean to create the person-centered plan? So they need to be trained on how to do that, right? If that's their role or your organization's function. We talked about accessibility with Monica showing us, some of the things they're looking for in the policy. If there's an outside of traditional business hours emergency, how is that handled? And does the new trainee know what to do or how to direct a client accordingly? De-escalation skills, if this is new for them, right? We talked about folks who are in, this is high stakes for them, some of the services, and they're in sometimes some distress, have a lot of psychosocial barriers or challenges. And so we may have to figure out how to keep ourselves safe and them safe, how to help them with conflict resolution. You need to learn those skills if they're new to this employee, and how to maybe implement some de-escalation techniques. And then figuring out how to help clients navigate and self-advocate if things are not going well for them. Maybe they're having an issue with their direct service provider assigned to them. Maybe they're concerned about the policy that you do have. And is there a grievance process? How do they address their issue with what's been implemented? How do you know that they like what's happening, right? Satisfaction surveys to keep track of how things are going from their perspective. And then staff supervision, like we talked about, some of these services are newer to you, so that you might be having to provide supervision very specifically to this, or training. And then is that a group supervision? Is it individual? Is that in-house? Are we contracting that out? Are we asking people to find their own supervisors? So what's the standard? What are the processes? And then, of course, how to document, right? How are they writing notes? How are they writing their service plans? How are they writing generalized things that happen, case management notes, when it comes to serving the client? And then these might be some things we want to consider that may happen every year annually, right? So we're just going to do refreshers. Like, we know things, but we might want to keep this on the forefront of their mind. Maybe there's some small change in the way things happen now. Maybe the law has changed and we need to make sure people know that, right? If they've been doing this a long time. Mandated reporting, how to properly do documentation, especially when it comes to billing and reimbursement. We want this to be right. Again, annual stuff every year, even though they know this, reminding them their duty to warn, how to manage thoughts of suicide and client safety policies. Again, you're going to refresh on the communicable disease stuff. HIPAA and compliance training should be annual, even if it's the same. If there is a change that, that's important to disseminate, but we want to make sure we're reminding folks of the processes and what should be the policy going forward. Also consider, like we talked about, some of these services are new to our organization. And some of the people that we're hiring, if the service isn't necessarily new, they may be new to this field of practice. So if we're getting into doing housing supports, we need to understand what housing first means, right? As a concept, what does that mean? And why are we doing housing navigation or resources in this way? What does it mean to provide harm reduction services? Maybe this person is, well-intentioned and wanting to serve people, but they need to know these evidence-based practice models of how to do this the best way possible, because research tells us that. We're looking at quality assurance, and we want to make sure we're providing good care for us. Sometimes it's not just what we think is best for people, it's what the data tells us behind the scenes, or models that work well for people in need and their respective psychosocial needs. So learning motivational interviewing skills, assertive engagement, maybe it's trauma-informed care. We talked about the vulnerability of the folks we're serving. They're high needs folks under 1959. And cultural competency, or at least cultural humility, right? Understanding who we are and who we're not, and opening the door for our understanding for the people that are sitting in front of us, especially if we are different from them, and being willing to have those conversations and reduce those barriers and hopefully reduce bias as a result. And so understanding who we're serving and how to serve them best, they're going to educate us in that, but do you have a training plan? How do you know that that's going well, and what training resources are you using? These are just some things to consider having available that first year to ensure, best success in the work that you guys are doing. So how do people know they're doing well on an individual level with their clients? So we talked about supervision before. So supervision, just to review that, there's lots of different reasons you're going to do it. You may be reviewing policy and procedure, the bulk of what we talked about today. It may be also understanding and orienting to your cultural way of doing things at your agency. What are your agency values? Why we do the things we do? How do we make decisions that align with that? So they're learning that in supervision, maybe one-to-one with somebody there. And then best practice knowledge, right? We just talked about some evidence-based practice ways of engaging with people, some terms, some philosophies on how we approach our work and why. And so folks who are very experienced, right? Maybe you started your organization, or maybe you're starting this new service and you're well experienced in this. Now this is the time to impart that knowledge into your new frontline service staff. And so that can be different than case conferencing. Case conferencing, I kind of think of as almost like a group therapy session, so to speak. So we bring a case to the table, someone puts it out there, and then we talk through what happened. Maybe we're debriefing an incident that occurred. And through that experience together, we get to elicit feedback from the group. We get to learn about something and how to handle it that maybe we haven't faced yet. This is a great way for new staff to learn and be onboarded to the work that you do and how to do that well. So I would definitely, recommend that you have a process to do case conferencing, to just debrief incidents, review your policies and procedures, and then maybe you'll get new ways of doing things, right? We have a new procedure now as a result of what we learned based on staffing that. So just a little bit of a reminder of what we talked about today. So we're working on going towards improvement, right? That's our goal. So policy is what you do and why, right? And procedure is how you do. And this needs to be informed. Yes, you are the person, maybe if you're in executive leadership, you formulated your organization, you had your mission and vision and values, but we also want feedback from the people we serve, from people with lived experiences. And so that's why we've mentioned throughout the training, having client satisfaction surveys, engaging them in this process. If you have a board, making sure folks who are being served by your services or have the potential to join your board, right? And then those policies need to be reviewed and approved by your board of directors if that's the case for you. Procedures, again, how you walk the day-to-day out, so that may not necessarily need board level approval, and they might be easier to revise if you have that scenario where you have a board. And then we talked about someone needs to wear the hat. Someone needs to be keeping abreast of the trends and changes, the expectations maybe from the state level, from Blue Cross Blue Shield, maybe in practice models, what's recommended is best practice. Someone needs to be kind of keeping track of those changes and saying, hey, we need to review our policies and procedures and make some amendments now to make sure we're meeting those expectations and we continue to be eligible for funding opportunities and that we're in alignment with those laws and those rules. And then what's your process for developing policy and procedure? Is it just the person who founded the organization said so? Or is there a forum to ask these questions, right? So it's important to think about who is the person that gets to help inform your policy and procedure development, and how is that process going to be walked out? Do we say we let clients inform it, but we don't have a place or a forum for them to do that? So we need to think about that. Does that look like you having like a place in a lobby of your organization where someone can share a survey? Is there an advisory group where they can meet and share their thoughts around how things are going for them? So thinking about how your organization implements and incorporates the client's feedback for those policy and procedures. And then training, what's your training plan? There should be a whole plan. It should be for the initial onset of them being employed with you and then ongoing, right? And so I saw too, we want to make sure that we want some trainings, maybe some leads on some of those trainings that we talked about, and continue education too, to make sure we're in alignment with what's out there as far as best practice for the services that we offer. So now we have more time for you guys to talk to each other about what we're going to be doing. So you should have had from the start of our whole experience here in Medicaid Academy a sample work plan that we gave you, where you can add some actionable items that need to happen, and also an assignment to who should be working on those things. And that's going to look different, right, depending on how far along you are in development and preparation for implementing the 1959 service this year. So we're going to spend about 15 minutes talking to each other again in our breakout rooms again, and we're going to talk about, so who's the agency lead, who's wearing the hat, or do we have someone that's already designated to do that? And so, like, how are our policies and procedures? You kind of gave me a vote there, but you guys can talk privately more about, like, are we really 1, 2, or 3? Where are we with things? And now we talked about the fact that Medicaid may be new for folks, so we're expanding services, and we have to make sure policies are in alignment with that document Monica shared. So who's going to be in charge of leading the revisions? And then how are we going to get that feedback from the staff and the service participants that we talked about? So like I talked about at the end, how do we know that this is going to work well for the people we serve? We got to hear from them. So how are we going to do that? now that we're going to make these modifications for the people that are frontline that are doing the work and from the people receiving our services. So if that is okay, Hillary, we're going to go ahead and put folks in their breakout rooms again so they can talk to each other again about this next step or the next stage of modifying policies and procedures.
Rooms are opening.
Yay.
15 minutes?
Yeah, we'll do 15 this time.
Okay, great.
That means we will be back at 50. I'm doing my math right. Yep. We'll be back at 50. That might be 14, but that's good.
And Burge, if it's cool with you, I've got something popping on another project I need to go pay attention to for a minute. So I'm just
We're
gonna,
good.
I'll still be here, but I'm not going into a breakout room if that's cool.
Okay.
Cool. Thank you.
be ready to come back. Hopefully that was helpful to us. Bringing everyone back. I'm curious to know, did anyone come up with some ideas or next steps to making these revisions, or even just thinking about how to incorporate feedback from your staff, from the people that you serve in the prospective program or even your current programs, to make sure that they are contributing their voice to these revisions that you might end up having to do or creating if you're writing your policies. Anyone to share some light bulbs, some findings, some ideas, some concerns? Love to hear from you guys.
This is Heather from Nexus Path. I guess I would just offer that, I mean, we're fortunate that we have a quality, you know, a QI person. And so it helps to keep things organized. But I guess for me, it's just keeping up, given this is so new and there's been so many changes to the state's policies. It's a challenge to keep up with the new policy issuances. And then, so we funnel them to our QI person who then can make sure our policies are updated if they are impacted. So I guess just reflection on, as with any service that we do, you know, keeping up with those policy changes that are come out from the state that impact our policies at the agency levels is really critical. Otherwise it comes time for an audit or accreditation visit and your policies aren't up to date with the changes that have occurred over the past year, which, you know, don't come out on a routine schedule, just come out continually as they arise. And so it's a piece of the work that I think often gets overlooked in terms of administrative, you know, oversight and resource. So that was one of the things we were thinking about.
I'm curious if Monica's still on. I was going to ask her if there's maybe a list or if people can join to get those notices immediately, or I know she said they have the site, and then the intent is to put those on there, and they already anticipate changes to the policy now that will reflect on that checklist that they'll be listing on there too. So I think that would be, if not answerable today, maybe something to take back and hopefully talk through and figure out, like, what's the best way to know that stuff.
Yeah, right now I don't have a listserv. It's very admittedly unorganized how I get information to people. And I do need to do that. What I would like to do, and we do have plans to eventually have kind of more of like a portal, like all information portal. But I feel like with our website, I would like to incorporate a section where it's like updates, you know, like news, 1959 news and any kind of updates that happen. We are actually in flux right now with our website, and with the merge with the Department of Health, where they're doing website work for us right now. So I don't know how much ours is going to change. So it might be probably like a month out before we can make some real decisions on what that's going to look like. But that is the intention, to have like a one-stop shop so that everybody can really be aware of the latest info. And our policies on our website are always the most up-to-date policies. So rather than, you know, doing a printout or anything like that, I would definitely say to go there and grab those from the website.
Monica,
Maybe have sort of a quarterly tickler or something to go check and see if anything's changed since then, until we get kind of that listserv out there.
sorry, I was
that
just
good
going to
idea?
add just to actually, you know, compliment. I know you said it's been disorganized, but we as providers, at least I am, I don't know, we are getting updates anytime there's a new policy change. So I mean, I think that's all that we could ask, is that we are informed when the policy changes, and then it's our responsibility to think about how that impacts the services we're providing under 1959, any of our own policies. So I do think that's being communicated effectively. I guess I was just speaking to the task and the upkeep of doing that and the importance of it, especially, in a lot of other service lines, the policies aren't changing constantly because they've been around for 15 years. These are constantly changing because we're learning as we go, so to speak.
Yeah.
The
Yeah.
state and the providers at the same time. So I do think that piece is going okay, Monica, just for you to know. And we
Yeah,
certainly know where the policies are housed and that they're the most current. So I think that's actually going okay.
Okay, so yeah, it's maybe more of a matter of like Ambrose or something, that internal like tickler, double check on those policy updates. If an agency is looking at doing stuff to policy, maybe, okay, let's hop on and take a look at the state stuff just to make sure we're still in line or those kind of things.
So believe it or not, this wraps up our session for today. You guys did it. You made it through policies and procedures. But definitely want to hear from you guys and explore maybe even some challenges you may have now that we're taking this back to folks in our agency, or just sitting with it and digesting it. So we hope to see you this Friday. We have an hour open forum, office hour, to talk through any challenges, ask any questions you guys may have around adjusting to these changes or implementing something new. And then just keep in mind, session 5 is coming on documentation and billing. So the money session, lots of people look forward to, but all the sessions important, but certainly understand folks definitely look forward to session 5 to have some very specific information on how to seek reimbursement for services. So you'll want your program, your fiscal, and your quality leads at that one too. So we'll see you, if not Friday, next Wednesday, same time, same place.